To discuss the impact of medics being told by Israel to leave Gaza City, we can speak to Dr. Mark Brauner, an emergency physician who volunteered at Gaza's Nasser hospital. He returned from the enclave at the end of June and joins us now from Eugene, Oregon. Doctor, we really appreciate your time talking to us. The medics and medical staff in Gaza City say they're not going anywhere, especially as Israel readies for a full-on takeover of the area. And this is likely because the number of injured people in that area is going to rise once that occupation begins.
Absolutely. So, Khan Yunis and Nasser Hospital are already overwhelmed with Al-Mawasi, the tent city, occupying more than 1 million people. Their medical system is on the verge of collapse by themselves, let alone a forced migration of another 1 million people from Gaza City south. And the fact that so many Palestinians are not interested in evacuating the city, and they're going to stay. The death toll is just going to be massive, and it's going to overwhelm their system. They're going to send people south to Khan Yunis, and both systems are going to be completely devastated and incapable of providing high-level care.
Doctor, what does an overwhelmed Gaza health system, particularly in Gaza City, actually look like? Because it's easy to think that right now the system is overwhelmed. There's very little medical assistance, vaccines that are needed, actual medication, even things as simple as paracetamol are just not getting in. So once the takeover actually starts, what is it going to look like?
Well, there's already been a virtual complete collapse of the system. I mean, a complete collapse. Somebody mentioned earlier, it's apocalyptical. It's absolutely insane. We're able to provide acute care for multi-system trauma patients. We're able to, put chest tubes in, stabilize their vital signs, give them blood, send to surgery, and that's an incredible feat. But all other parts of the healthcare system, from chronic illness to preventative medicine to post-surgical rehab, everything has completely failed. The children are starving at the Children's Hospital. There's no specialized formula coming in. It's beyond devastation. It's beyond the set point for a lot of people to survive. The death toll is just going to escalate and climb day by day. And so it's already an overwhelmed system. Nasser Hospital typically had 12 ICU beds. They are now operating at about 100 ICU beds, makeshift ICU beds. So they're 1,000-fold past capacity.
Mm-hmm. Doctor, you have more than 20 years experience, but you recently wrote an article where your opening line was, "Nothing prepared me for Gaza." Just take us through that statement.
Yeah, well, nothing's ever happened like this before. I've talked to colleagues from the U.S. Army that have been in Iraq and Afghanistan, and they never saw anything like this. There's no equivalent in modern history. These hospitals, these community hospitals, these government hospitals are not designed to handle massive warfare and genocide. There is no comparable situation in modern history. So there's no way to be prepared for it. I went in, pleasantly surprised that Nasser Hospital is relatively high functioning from an acute care standpoint. But, having, 10 small children lined up with gunshot wounds to the head and trying to take care of them simultaneously is overwhelming.
Absolutely. And you've launched a campaign in the U.S. to get Congress there to enforce a law that suspends military aid to Israel. How much traction has this campaign had?
Surprisingly, very little. So the latest polling shows that 62% of Americans want the genocide to stop. And yet we've been appealing to the U.S. citizenry and asking them to sign a petition at stoptheidf.com, stoptheidf.org. And so we can take this petition. We want more than a million signatures. We have 4,000 currently. And so there's a huge asymmetrical issue here with the number of Americans who say they want the genocide to stop and the number who are signing the petition. So we urge all U.S. citizens to go to stoptheidf.com, stoptheidf.org, and sign our petition so we can compel Congress to enact an already on the books law called the Leahy Law, which forces them to stop funding the IDF until there's a comprehensive, transparent review.
Thank you very much for taking the time to speak to us, Dr. Mark Brauner, and for the work that you are doing. Appreciate it.
You're welcome.